tendons that control finger movement become inflamed, often leading to pain, stiffness, and a locking or catching sensation in the affected finger. Trigger finger most commonly affects the thumb, middle, or ring finger and can cause these fingers to get stuck in a bent position. This condition affects individuals of all ages, but is more common in people over 40, particularly those with jobs or hobbies that require repetitive gripping actions. Additionally, conditions like diabetes, rheumatoid arthritis, and even carpal tunnel syndrome can increase susceptibility to trigger finger. The tendons that control our fingers pass through a series of small sheaths and pulleys, which allow smooth gliding as we bend and straighten our fingers. In trigger finger, the sheath around the tendon becomes inflamed, often due to repeated strain or overuse, which creates a painful nodule. This nodule can prevent the tendon from gliding smoothly, leading to the catching sensation as the nodule struggles to pass through the pulley. Over time, if left untreated, this can worsen, causing the finger to become stuck in a bent position and eventually leading to stiffness and reduced finger function. A typical case might look like this. Sarah, a 52-year-old craftsperson, came to her primary care physician complaining of a locking feeling in her middle finger. She'd noticed it catching while working on fine crafts, and over the past few months, the catching had become more painful, especially in the morning. Sometimes she had to manually straighten her finger, which was uncomfortable. Sarah was also diabetic, which increased her risk of developing trigger finger, as diabetes can lead to microvascular changes and increased tissue stiffness. After discussing her symptoms, Sarah's physician performed a physical exam, which confirmed the diagnosis of trigger finger. Trigger finger diagnosis is typically clinical, based on symptoms and a physical exam. During the exam, the healthcare provider may feel the base of the affected finger and note any tenderness or a palpable nodule. Flexing and extending the finger may reproduce the catching sensation or display the finger's limited movement. In most cases, imaging isn't required, as physical findings are usually sufficient for diagnosis, though ultrasound can sometimes be used to assess the tendon if necessary. Managing trigger finger varies depending on the severity of symptoms. For mild cases, rest is often the first line of treatment, allowing inflammation to subside. Avoiding activities that involve repetitive gripping or strain is essential, as is applying ice to reduce swelling. Some people benefit from gentle stretching exercises and hand therapy, which can maintain flexibility and strengthen muscles surrounding the affected tendon. A 2021 review published in the Journal of Hand Therapy found that individuals with mild trigger finger showed significant improvement through stretching exercises alone. Though these are most effective when symptoms are caught early, splinting is another conservative option, especially for those who need a reminder to avoid overuse. A splint holds the finger in a straightened position, reducing stress on the inflamed area and helping to ease symptoms. Many people wear splints at night to keep the finger extended, as the bent position can lead to morning stiffness. A study from 2022 confirmed that night splinting, when used consistently for several weeks, can effectively reduce symptoms and improve function for many individuals with mild to moderate cases of trigger finger. For cases where conservative methods aren't enough, corticosteroid injections are often used. These injections reduce inflammation around the tendon, which can help the nodule glide more smoothly. Research indicates that corticosteroid injections are highly effective in reducing pain and improving movement, especially when administered in the early stages of trigger finger. In a 2020 study, over 70% of participants reported significant relief following a single corticosteroid injection, though some required a second injection within 6 months to maintain improvement. When symptoms are severe or don't respond to non-surgical treatments, surgery may be necessary. The most common procedure is a trigger finger release, where a small incision is made to cut the pulley, creating more space for the tendon to glide freely. This surgery is often done under local anesthesia and is highly successful, with most patients experiencing full symptom relief and regaining normal hand function within a few weeks. Minimally invasive techniques like percutaneous release have also shown good results with shorter recovery times. A 2021 study found that patients undergoing minimally invasive release experienced similar improvements to those who had traditional surgery, but with a quicker return to daily activities. Recent research supports the importance of early intervention and conservative management in preventing trigger finger from worsening. A 2022 study in musculoskeletal science and practice concluded that combining physical therapy with corticosteroid injections was highly effective in the early stages of the condition, reducing the need for surgery in many cases. Additionally, recent studies on corticosteroid injections have examined their long-term effects, with findings suggesting that while injections are effective, they may not fully eliminate symptoms for all individuals, particularly those with diabetes. Another interesting area of research has explored the connection between trigger finger and other conditions like carpal tunnel syndrome and diabetes. Studies have shown that individuals with multiple musculoskeletal conditions or systemic diseases like diabetes have a higher recurrence rate of trigger finger, suggesting that lifestyle management and preventive care can play an essential role. A 2021 review indicated that people with diabetes were up to 5 times more likely to develop trigger finger than those without, likely due to changes in connective tissue and blood vessels associated with diabetes. In summary, trigger finger is a common condition that can affect anyone, though it's especially prevalent among people who engage in repetitive hand movements or have certain medical conditions. With a combination of rest, splinting, and, if necessary, injections or surgery, most people can find significant relief from symptoms and restore hand function. For anyone experiencing pain or locking in their fingers, consulting a healthcare provider early can make a big difference. Thank you for watching, and don't forget to like, subscribe, and stay tuned for more insights on musculoskeletal health.